Hello, everyone, and welcome to this week's episode of Recovery Talk. This week, I am joined by the wonderful Dr. Miriam Sanchez. So, we are going to have a conversation about eating disorder treatment and also working with eating disorders as someone who has personal recovery experience. We're going to talk a bit about what the system gets right and also what the system gets wrong. And overall, just have a very interesting conversation about eating disorders and recovery that hopefully will give you guys some hope and insight.
Okay, so I am here with Dr. Miriam Sanchez. Hi, Miriam.
Hi, Emily.
So nice to see you and so nice for you to be joining me here today. So we are going to talk a bit about, the fact that me and Miriam, we both have a very unique experience of having had, lived experience with an eating disorder and now working with eating disorders. So I think the first thing that I wanted to kind of ask you is, how do you use your lived experience when you are working with clients? Is that something that you're using, or is it something that you're more mindful of maybe not bringing up?
Yeah, I'm really glad that you asked me that question, because I know there are different approaches from professionals about this. Many professionals have lived experience with eating disorders, but some of them prefer not to talk about that. But others, like me, and I was, trained in the Caroline Costin Institute. So Caroline Costin specifically trained us about how to use our lived and personal experience living with an eating disorder and being recovered from an eating disorder to help better our clients. So from my perspective, I do use my personal experience, but I am very mindful about that. So, for example, I don't go into the details of my eating disorders. I definitely use my, my strategies, how I cope with recovery, how was my motivation, what techniques did help me more in my recovery process, okay? And that kind of thing help my clients a lot. Also with empathy and compassion, because of course it's not necessary for professionals to haven't lived, with an eating disorder to help their clients. But of course, if you have lived with an eating disorder, you can connect better, more deeply with your clients if you use that experience very mindfully. So definitely that connection, that emotional connection, that empathy, make like more easy to create the therapeutic alliance, like the connection with my clients, definitely.
Yeah, I noticed that with clients that, there will be a sense of, they will trust me because I've been through it. But it's always that balance between, using your lived experience without making it about yourself, right?
Yeah.
That's constantly the balance. But yeah, I think it's an interesting one. I think that lived experience, when utilized in a productive way, can be so, so helpful and really like strengthen that therapeutic alliance, right?
Yeah, absolutely. I think that we have to combine life experience with a lot of reflection, a lot of study, a lot of abilities and skills, like you and me, that we work as recovery coaches, no? But definitely life experience have a lot of, to help to our clients.
Mm-hmm. I think this is an interesting one, because I talk with a lot of people with eating disorders that want to work on helping others, right? And very often they say, I want to recover so I can help others with eating disorders. And I very often think like that is, of course, very good. That's a great, very like noble thing to want. But I always tell people also, make sure that you put on your own safety mask before helping others, because I'm just thinking for myself, if I had gone into the work I'm doing now when I was just fresh out of recovery, that would have been very, very triggering to me, right?
Absolutely, absolutely. And I understand that, okay, it was the same for me. I understand that if you have recovered from an eating disorder, you have that motivation, okay, I want to help people, to have a good life, to recover from this illness. I understand, okay, and I think it's more than okay. But first, you have to be safe and you have to be ready, and be especially be sure that you are fully recovered. It's not that you are in quasi-recovery, but we know the hell of the quasi-recovery, and maybe you are in a, very advanced in your recovery process, but you are still in that quasi-recovery place, and maybe you need some external help to be aware that you are not still fully recovered. So that's a first problem, that the person has to be in fully recovered. For example, the Caroline Costin Institute, if you want to be trained by the institute, you have, they make interviews to see that you are fully recovered, not only physically. And not, we are not weight centric, it's not about physical, but your mental and emotional state has to be aligned with good recover.
Yeah, that is so important. I do think that there's a little bit of a problem in the recovery community of people who are kind of like just jumping into being, so-called recovery coaches without having taken time and without, having had much training. And then it kind of, that creates some unfortunate situations. So I think it's good that, for instance, like Caroline Costa Institute has some kind of like check. Yeah. Not just like accepting everyone. Yeah.
And of course, although you make checks, this kind of checks, of course, there is no, guarantee of 100% that, okay, you are fully recovered, so you can't have a relapse, okay? But still, in the process of training as a coach or as psychotherapy or a nutritionist or whatever, you have to be mindful with yourself and check yourself when you, for example, put in the market and you are working professionally as a professional with people with eating disorders. You have to check with yourself and be very true about how are you feeling, how are you, how is your thinking about yourself, about your body image, about your eating, because, okay, all the past eating disorder triggers will be with you day after day.
Yeah, that is such a good point. That is actually so important. And, another thing, from one thing to another thing that, I've been thinking a lot about is, the system of eating disorders, like eating disorder treatment system, like what is it that they do right and wrong? And I think you come with this from such a unique perspective because, you come from like more like a clinical psychology background, right? And when you look at, and of course you would be speaking from the perspective of Spain, what is it that the system, in your opinion, don't quite get? And also, is there something that they are quite good at? Is there any, is there any positives? What are the positives? What are the negatives, right? Because we kind of want to work with the system as well, right?
Okay, so let's start with the positive, okay?
Okay.
So yeah, in the last years in the healthcare Spanish system, there are some good advancements. Like, for example, they have created these eating disorder units. So with multidisciplinary teams, including psychologists, psychiatrists, doctors, nurses, nutritionists. So they have created these eating disorder units or clinics in different regions within Spain. So I think this a positive step towards the good treatment, but there are many problems with this kind of units. First, from the point of view of the scarcity, because these resources are not enough. They are, they have very low, for example, if we talk about day hospitals or hospital care, there are very, very, very few beds for people to stay there. So they are definitely very few. Then about the quality, because the quality of the treatment, oh my God, sometimes is very low. In terms of the treatments are, this is mainstream, okay? The mainstream of treatments in Spain are fat phobic and weight centric. And this is, the main problem I see. Because from the psychology perspective, I see a lot of improvement. For example, they apply self-compassion and acceptance, cognitive behavioral techniques. From the psychology perspective, is more than okay. But when we talk about the eating, the diet, the approach to nutrition, oh my God, that the quality reduced a lot, because it's all about fat phobic, it's all about the diet mentality, demoralization of food. So that's the main problem I see.
Yeah. And I think that's so tricky because, you can do you can have all the self-compassion and CBT you want, but if you're being told essentially by a treatment team, oh, let's focus on eating quote unquote healthy, don't eat too much of that. Like that, when you have an eating disorder, is just so detrimental. And that's something I hear a lot from people who've gone through, traditional system, although, it's been helpful in the way that it's maybe have even saved their lives when they've been at a point where they needed medical intervention, or it's just been, having one way or another help them. But then it comes to a point where the medical, like for instance, their dietitian will be like, oh yeah, it's fine if you don't eat cake, right? Because it's like, yep, whatever. And then they kind of feel like they stay stuck in quasi recovery because they essentially, the treatment, I feel like mainstream eating disorder treatment is it's about keeping people out of hospital and keeping people, medically stable, rather than making people 100% free. And I guess this is more where me and you come into the picture. Like I will dig in with my clients to find like, what is it that you're avoiding? What is it that you fear? And then we go do that, right? And I think this is something that, hopefully it's becoming more of it. At least in Norway, they do that a bit. But it's something I think is overall quite missing, like focusing on challenging fears and rewiring fears, not just, weight and weight restoration. Of course, that's important. It's so, so important. But you also need to focus on rewiring fears, right? Don't you think?
Absolutely. I work with an approach that we not only focus on nutritional rehabilitation, including in some cases, the weight restoration, but also the neural rewiring. Because, okay, you can gain the weight you need to your set point range if you eat like veggies and fruits and fish and egg, but if you still keep, with a lot of feed foods, and you are not able to eat whatever you want, whenever you want, then you have a problem. Because, you still have a lot of fears around food, and you still fear that if you eat in some ways, you will gain weight. So that's, the core fear in eating disorders.
Yeah, that is so, so important. And I think that's so important, the whole thing with like rewiring the brain, and just because it's like with eating disorder, the brain will just connect certain foods with fear and certain foods with certain actions. Like if I eat this, something bad will happen, right? And so much of what I'm doing with my clients is like, they go out and they eat a fear food, and then they realize the world actually didn't end. And when they do that, they do it once, maybe they can't feel it right after. They might get like a boost of confidence, but then when you keep repeating that, you keep repeating and challenging your fears. It's the same. I always use the metaphor. I feel like I use this metaphor so many times, especially on podcasts, but it's like when someone is scared of dogs, you actually do need to go to the dog park, gradually expose yourself to it. You can't just sit at home reading about dogs. You need to actually go out there and do it, right? And I think that's so, so important. Like the rewiring part of recovery is just so, so, so important.
Mm-hmm. Yeah, absolutely. Exposure therapy is, the way to go to overcome this kind of phobia about eating of food. But the main problem is that, Amalie, that it's not only that in the society we have a lot of fear-mongering about food and eating and orthorexic tendencies, but, the irony for me is that in treatment centers, the most fatphobic and fear-mongering about food and orthorexic is in the professionals.
Yes.
Because some of them, I don't want to generalize, okay? But many nutritionists that I know and the advice they give to people with eating disorders are, ingrained in orthorexic tendencies, in diet culture. So it's impossible to recover from a restrictive eating disorder or an eating disorder with more restriction. Restriction leads to restriction, so it's impossible,
That is so true. And I think this is what is so frustrating, because I always tell people with eating disorders, of course, you need to seek help. You need to, get a dietitian. But then it's also part of me knows that there are some people who are going to do that and then have a dietitian that themselves is invested in diet culture. And I think this is what I tell people over and over, that diet culture and fat phobia is so ingrained in our society. And it's unfortunately also ingrained in the medical system. Again, it doesn't mean everyone, because there are a lot of amazing dietitians who have really, really healthy views on, food, body, et cetera, and amazing people. But unfortunately, it's a little bit one too many, where I will hear from people who've gone to a dietitian and been told not to eat this and that, and just gotten their eating disorder reinforced. So I think this is just unfortunate. Like, it's not only that certain practitioners can be ineffective, but it's certain cases they can almost make it worse, right? And that is just something that for me is just, I don't know, what would the solution to this be? I'm thinking training, but is it maybe the training itself is not covering this? Like, what is going on? Because I heard that in the UK, a GP gets the average GP get less than 2 hours training on eating disorders, and a lot of them get 0 hours. Like, what do you think would be the solution? Training? What are your thoughts? What can the system, what needs to change here?
Yeah. I think there are, of course, the solution is not easy, okay, and it's not quick, but of course, in the training is essential, because it's not about only the doctors, it's about the nutritionists, dietitians, the psychologists, okay, they receive a fat-phobic, weight-centric and diet mentality training. So doctors, especially, for example, endocrinology, some specialties within the medicine, is basically weight-centric. So that's the first problem. In the training of these people, they are developing their mindsets. So when the doctor goes to the faculty and they are told that, okay, the problem of all these illnesses, the main risk factor is obesity, quote unquote, obesity. Yeah. Okay. That's the first problem, because they associate, they are pathologizing some weights, and they are associating the weight to the illness. So gaining weight or having some weight is bad. And this is, the main problem. And also because they are trained with the idea that people can have the way they want. It's just, self-control. It's about self-control. It's about self-discipline. So, okay, weight is not something that is determined by genetics, by biological factors. No. If you eat this and that, and if you move this and that, basically diet culture, then you will have this weight. So then the doctors and also the dietitians and many psychologists too think that if they are working with fat people, with people with higher weights, it's their guilt. It's not about, their biology. It's not a pathology. So I think this is a big problem, first in the training and also in the culture. So we have, this coalition, this correlation between the cultural factors and the training factors in the medical faculties, dietitians, and other health professionals.
Yes, yes, yes. That is so spot on. There is this like myth that our body is like something we can just kind of like mold ourselves, and it's something like it's literally just energy in, energy out, and then you decide your own body. But that's not really how our bodies work. We could all eat the exact same and we would still have different bodies, right? And this is just such a key, like because this is the thing I often like think about. Like, you can't have a treatment professional that fears the same thing as the eating disorder, right? If you have that, then I mean, what you're going to do? It's like going to treatment for a dog phobia to someone who's terrified of dogs, who keep talking about, oh, be careful with dogs though, they might bite you, right? It's like, you're not going to get better, right? So I think it's so important what you say, that it's just like, and I hate that there's no simple solution. It'd be very easy to just point fingers and be like, this, that, that's how we solve it, right? But that this is actually like a systemic issue. This is like a wider societal issue. It's the training, but it's also like the beliefs of the culture. And I think that is just, it feels sometimes overwhelming when you look at it. You feel a bit powerless. I don't know. Do you feel that? I sometimes just look up and I'm just like, there's so much here, right?
Yeah. I feel the same. Sometimes, because I align myself with health at every size, fat acceptance movements, body neutrality, this kind of movements that I appreciate a lot. But I always say that thanks that I am able to read in English, speak in English, I am learning about those approaches, because in Spanish, in Spain, in Latin America, it's even worse. You don't have training in these new frameworks, in these new paradigms of weight inclusive, health at every size. So this is a problem, because first, many healthcare professionals don't know about these new paradigms. It's okay, not new, because, there are a lot of research and many years of fat acceptance movement and these kind of things. But first is ignorance. And then some professionals know about the existence of these new paradigms, but they are very resistant, of change their mindset, open their view, and of course we know they fear to lose the privilege they have. Imagine that you go to a clinic that do these surgeries to reduce weight, and from one day to another they close the business, so they don't do money. They don't do money because they are selling weight loss. When we know that that's not an intervention based on health, they are no evidence to support that weight loss interventions.
This is the thing. I think this is in general, when you see something kind of like follow the money, right? And then you see that with diet culture, it is big bucks. Like, this is a million, if not billion-dollar industry. Making people feel like their bodies are wrong is big money. It is big money. And the thing with diet culture is that it creates repeat customers, because we know, me and you know, that dieting doesn't work. We know that 95% of dieters will regain weight, often with more back. And that is a genius from a marketing perspective. That's genius, because it creates repeat customers, right? Because you go on a diet, and because of anything else that had a 95% failure rate, like imagine if there was a medicine with a 95% failure rate, you'd be like, this medicine don't work. But because diet culture becomes tied in with moral, it's this belief that if you didn't succeed with something with a 95% failure rate, it is a failure on your part, and you just need to try harder and try again. So you try again, and you try again, and you try again, and you have a repeat customer there. So like, I hate it from an ethical point of view, but from a marketing and just consumer point of view, it is genius, right? But it's just when you look at it, it's like, wow, this is a scam, right? And I think a lot of people who work with eating disorders or just have had an eating disorder, just have that moment of realizing this is all a big scam. Like, this diet culture is a scam, right?
Absolutely, absolutely. I always say that, it's so difficult and challenging. And for this, all my compassion for people now in recovery from eating disorder, because more than ever, it's so difficult to recover from the eating disorder, because we know that eating disorders have existed always. It's not something new. It's not, a consequence of diet culture. No. Another thing is that diet culture is a factor that, challenge the recovery process, make the recovery more difficult, or it's a factor, a risk factor to develop an eating disorder. But anorexia and all the eating disorders have existed, for ages. It's not something new. But of course, the rates of eating disorders have increased because of this sociocultural environment we live in. Of course, is for that.
Exactly.
So it's really difficult. But the worst harmful and ironic thing I see is in the eating disorder treatment centers. So, it brokens my heart when my clients said to me, okay, I've been in that clinic or in that hospital, and the nutritionist or the psychiatrist or the psychologist told me, oh, you can eat because you have a body mass index of whatever, within the normal range, more than 20 or whatever, and you can't eat more. So if you have more hunger, you can't eat more calories, because you have to eat the calories we put on your meal plan. Oh my God.
Yes, this is the thing. And this is, so treatment centers will very often, they will set a specific BMI as, like a minimum. But of course, what very often goes wrong here is that it will get assumed that this is a maximum. And now I think it will also it's the treatment professionals fearing what the eating disorder fear. Like, they're thinking that if we allow someone to go above that minimum, they're going to panic and relapse. And then we're going to have another patient again. But actually what you see is that when you allow someone to get to their set point weight, mentally and physically, they become so much healthier. And actually I felt like I actually had good experience with treatment professionals, because my psychologist, even though we worked on a minimum BMI that I needed to achieve just, to be safe, but of course I needed to go above that eventually, but that was like a minimum BMI. But she showed me like a graph, and she said that if you actually go higher, if you go above that minimum of like 20, that was like the bare minimum before they were like, yeah. And she said that if you go above that, you're actually statistically less likely to relapse. Right. And I'm so glad she told me that. And she showed me like the graph and everything. But again, felt like I was very lucky with my psychologist, because I will have clients who are told, oh, you're at the BMI of, let's say 20 now, and then you should eat this meal plan and stay there, because if you gain more, you might freak out and relapse. Right. And of course, the eating disorder will interpret this as it is bad to be above a BMI 20, when actually what they mean. I had this conversation with my sister, because she used to work with eating disorders, also a psychologist. And she said that the reason why they're setting these things, and the reasons why they're saying, BMI 20 and not encouraging going over it, is because they're scared that the person will relapse. But it's just not based in science. It's based in their own views and projections. It's based on them fearing what the eating disorder fears. Because when I get clients to me, very often what they're saying, I want to reach my set point weight. They're not saying I want to reach this, they're saying I want to reach my set point weight. Right. I think this is just what I wish treatment center understood, that people with eating disorders very often are actually willing to collaborate and work on recovery and work on full recovery.
Mm-hmm, absolutely. And that's another problem, because that many professionals don't believe in full recovery. So that's another problem.
Yes.
Another big problem, because many doctors and psychologists, I talk about with them a lot about this, and they say to me, okay, this is like a chronic illness. You just have to, get used to the symptoms. You just control not to eat very, very, very low, but it's not so bad. Oh my God.
Yes. I have had several clients that have come to me and said, I was told that this is something I'm never going to get rid of. This is something that's going to be there forever. And don't get me wrong, there are people who have an eating disorder for the rest of their lives, but not even saying that it's not possible. Like, imagine if people said that to, for instance, like drug addiction or alcoholism, like you're going to drink for the rest of your life, right? Like that's just not true. Like recovery is possible. Like recovery is absolutely possible. But imagine the fuel for the eating disorder. If you have been told by your treatment professionals that recovery is not possible, and this is chronic, it's essentially inviting the eating disorder to stay, right? It's telling the eating disorder, make it your home here because you're here to stay, when actually it's just an annoying guest that you want to kick out, right?
Yeah, absolutely. And that creates a negative self-fulfilling prophecy,
Yes.
that limiting beliefs that, okay, if the doctor told me that I can't recover, why is the effort for? Because we know that first the recovery feels worse until it feels better.
Yes.
So, of course, if the person with the eating disorder feels very worse in the beginning of the recovery process, and then the treatment team told her, okay, it's not, you can't recover. So that's why, okay, I failed.
Mm-hmm. Yes.
I am in the process. So,
yeah.
those limiting beliefs about the recovery is not possible, I think, harm a lot to people.
Yes, it's so harmful. And well, I'm just thinking for myself, if I had been told that full recovery was, oh, that's just not possible for you, that would have really, really damaged me. And I always tell people, like I tell my clients, like, I'm not ever, like, I don't use the word like chronic case. I don't deny that there are people who have an eating disorder for the rest of their lives. There are people who never recover, and we can respect and support people regardless of where they are in their journey. But I still think that saying that this is something that's impossible to recover from, or this is something that you'll always kind of have, I would think that it's fair to say you'll always have the vulnerability, right? You always, have a risk of relapse statistically, and you always will. I know for myself, as someone who's had an eating disorder, that I could never go on a diet. I know that if I went on a diet, even though I'm mentally like recovered, my body, like certain things will shift in my head that would not be very good, right? But saying that recovery is not possible, no, it's frustrating, right? And it's like, because well, it's not possible for you because you're not treating your patient with the right approach. Your patient is not recovering. Of course, recovery is not possible when you're telling your patient they can't go over that BMI or they can't eat more than those calories, because obviously then they're not going to recover. They're not going to suddenly wake up and be free, right? So it's like, maybe treatment professionals should also look within if they are actually facilitating full recovery.
Yeah, of course, this is very important, because this belief of full recovery is not possible harms the clients, harms the patients, but also harms the professional, because if you think that it's not possible, especially when you work with people with long-term eating disorders, this is important to talk about. If you have a patient, for example, with more than 20 years, long-term eating disorders, this category, I hate the category of chronic eating disorder, comes to the mind of the doctor or the treatment team, and then the way they treat the patient is different. So less effort, less focus on these people. So I prefer to focus more on the younger people, for example, or people with eating disorders who have, short-term eating disorders, because then my expectation and my success rate can increase,
Mm-hmm.
So these kind of biases, these kind of beliefs in the treatment centers and treatment teams is very important to work and to explicit and to combat, because then can affect the efficacy of the treatment. But not because recovery is not possible, but because of the beliefs and the biases of professionals, the beliefs about the recovery process.
Mm-hmm. That is so important. And wow, I have to say, I really appreciate, you sharing some of these insights. You had these are some really, really good insights. And again, you have the unique perspective of, being in the system as a patient, psychologist, and now as a coach, and seeing it from like all angles. And I want to also like applaud you for spreading the message in Spanish, because I know that a lot of it is in English. So for people who don't speak English, there can be, a big like blocked, like you can't access it, right? So the fact that you are spreading the word in Spanish and offering these resources is amazing. I wish my Spanish was a bit better so I could like tune in and understand everything, because I'm like reading and I understand like a Belfib, and my Spanish is quite bad, and I'm just like, I want to understand your post better. Because it's so important. And yeah, especially I've gotten quite a few messages from people from Latin America that says that the system there is like quite bad and there's completely no resources. So hopefully hopefully a lot of them find their way to your page.
You know, I have many connections with professionals and people in Latin America, and the situations there is very worse about treatment, about even the awareness in the society about this disorder. So it's very very sad. And that's why I translated two of the recovery books from Tabitha Farrar, because their blog, their work in general from Tabitha Farrar helped me a lot. And that's why, 3-4 years ago, I don't remember, I had the decision to, I have to, I want to spread the word in Spanish, because I know I receive, many messages from people in Latin America or people in Spain, that they don't have the money. They don't have money, or they don't have access to good treatment centers, and at least they have the knowledge in the book. So, this is a topic for another podcast, but this question: is possible the recovery without treatment? Without receiving professional support? That's a topic for another podcast. But of course, I think that the most important thing in the recovery is the person. Is the implication, the commitment, the determination of the people with the eating disorder, that they will do whatever they need until they are fully recovered. So this is the most important thing, because I know many people who have access to the best, quote unquote, the best treatment centers, the best, quote unquote, professionals, but still, if they are not committed to do whatever they have to do, not only with the eating and food stuff, but also with other areas, the rewiring and the, some more deep work they have to do, emotionally speaking, you still will live with an eating disorder. So it's not only about the quality of the treatment, it's especially about the commitment of the person living with an eating disorder.
Wow, that is very, very powerful and very, very true. And also that's an interesting conversation. I think I need to invite you on again. So I feel like that is such an interesting one, but this episode is getting long. So I guess that will be for another future potential episode. So I want to really, really thank you for coming on. And it's been so lovely to hear your perspective. And I think my audience really enjoys it as well. I want to really thank you for your time.
Thank you for having me to your podcast. I'm, very happy. I feel sorry that my English is not so fluent.
Oh no, your English is great. Your English is great. And actually the majority of my listeners are non-native English speakers. And I have a lot of I'll have guests that are, not always native English speakers, but your English is great, so that is no problem at all.
Okay, thank you. But in my balance of I will take this read or not, all of us have these little insecurities.
Yes.
But still, I think it's better to spread the word, even if my English is not perfect. I prefer to take the risk and spread the word, to get to know people that recovery is possible. Yeah. There are many resources that, we don't have, very compassionate and very helpful culture now, but still you can recover. Although we live in this fat-phobic diet culture, you still can recover.
Yes, exactly. So essentially, feel the fear and do it anyways, whether that is going on a podcast when English is not your first language, or jumping into recovery. Feel the fear and do it anyway. Okay.
That's my favorite mantra.
Yes, mine as well. Thank you so much, Miriam.
I hope you enjoyed this conversation, and you can follow Miriam on Instagram at miriamsanchez.tcacoach or at recovered2be on Instagram.